In 2012, community medical centers helped start an accredited chaplain education program in the Valley to train individuals providing professional pastoral care to those in hospitals, for first responders, and in times of crisis. Now that training is expanding to other types of chaplains. With the Central Valley providing employment to hundreds of thousands of immigrants, chaplains play a significant role in their mental health and success. We talked with police chaplain Paul Gendron, who founded Workforce Chaplaincy, a nonprofit organization with a mission to help workers cope with adjusting to their lives while away from their home country, family, and friends.
So one of the thoughts that I had was most people spend more than half of their waking hours at work, and so the workplace is an extended family for people, whether that's farm workers or industrial workers or professional workers, and the opportunity to give care and express care confidentially is something we get to do where they work.
The Central Valley's booming agricultural industry is a setting that often sees a deeper need for the work of a chaplain.
Sometimes the men feel lonely, and so they just need someone that they can talk to and just listen to them about their lives back home and what they miss while they're working very long days here. We know that the men love coming to the United States because they can oftentimes earn 7 to 10 times as much here as they might earn in Mexico. And so it's an incredible opportunity for them. But it also comes at a cost.
Away from families, and many of them are dealing with grief, because it may be temporary grief, but they miss their family members, they miss their children, they want to see them, but they cannot. So it's impacting their working. But when chaplain goes there and support them, they really get the connection from each other, and sometimes they find another meaning. They really re-find their meaning of their life. How to be here makes sense.
Reverend Keto On is the program supervisor of the Clinical Pastoral Education, or CPE, program in the Valley. Community Medical Centers supports the training program and provides clinical experiences in the hospital for chaplain trainees. Last year, funding expanded to specifically train chaplains who are working with underserved rural populations like farm workers.
And so it's excellent training. It's very rigorous when it comes to the mental health side of coming alongside people. We're not therapists, we're not counselors, but we are skilled listeners and can support people in a variety of different things, whether they're related to their family, maybe a marriage, but the common things that people struggle with, we like to come alongside and support them in those areas.
Workforce Chaplaincy sent its employees through CPE training and partnered with Fresh Harvest, an ag labor and harvesting company that recognizes the great importance of providing chaplains for its workers. Chaplain John Gutierrez explains that it's not a job to him, it's about being a friend to someone in need.
The things that I find very rewarding, surprising to me, is becoming friends with them and earning their trust where they talk to me as their friend. Not as somebody with authority, not with somebody that has a title, but someone they know they can talk to and will listen to them. And to me, that's the goal. Every season that comes up and new individuals come in, I want to earn their trust. I want to be able to know that they can talk to me anytime, any place, anywhere, anything, and know that I'm listening.
A typical day for a worker is to wake up, go out to the fields, come back, have dinner, shower and sleep, then repeat, with not much time to make connections in the outside world, except for when a chaplain comes and visits. One of the goals of a chaplain is to give workers motivation to work towards something.
I try to emphasize to them, come with a purpose. Don't come just to make money, because then you'll go home, throw a big party, and spend all your money, and what's the end result? Better your families. You're away from your families. Use that time to make something with your family and for your family, and let your family know how much you care for them and that you're willing to work hard for them. So that's one of the things that I try to drill in them all the time.
In order to become a chaplain, students must complete a minimum of 1,200 hours of practice and classes. Before Community partnered with other hospitals to set up the accredited training program here, those wanting to be chaplains had to travel far outside the Valley for their training.
Now, with Clinical Pastoral Education at Central Valley, we can do that here in our own backyard. And so it's a great partnership between community hospitals and between CPE and between Fresh Harvest companies that are generous and really want to see young men not only work hard in their company, but also be supported so they can be successful here. So I really see it as a kind of a wide network of relationships that we all bring to the table to support people.